Joining us now to talk about all this, Dr. Robert Murphy. He's a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning.
Good morning.
So everyone kind of freaking out about this mutation to this happening in the United Kingdom. Talk about if we should be worried about that and if the vaccine can still take care of it.
Well, we should be very worried about it because this is a change. This is a mutation going in the wrong direction. Easier to spread. Can you imagine with the way things are going in the United States right now, if the infection rate, increases by 70%? It's really, really a crisis. Now, the good news is so far, although no one's really seen any of the hard data, so far it doesn't look like the virus is acting any worse than usual, and that it's just spreading faster. But I mean, this is a terrible development.
We kind of expected these mutations to happen, though, right?
Yes, yes. With this much virus out there uncontrolled, it's mutating all the time. So we should. There's absolutely no surprise. What the surprise is again the delay in locking everything down where the virus came from. I mean, flights are still coming here from London. The airport should have been shut last week.
So what are your thoughts about how vaccinations are going so far here in our area?
Well, it's been a little bumpy, but this is a very challenging thing. People are getting the vaccine. I'm scheduled to get it at 9 a.m. today. I'm very happy for that. And I am a frontline worker, if anyone is interested. I see patients every day and test them for COVID. I wear full PPE and everything, but all frontline workers are eligible to get the vaccine. And my department, two have already gotten the vaccine, and I'm getting it today. And we have two others that work on this one project with me will be eligible later this week.
With Moderna now, the second vaccine being out, does this mean we might see these vaccines rolling out quicker since there's two providers?
Yes, right. And so you're going to get more healthcare workers. And then the CDC announced this weekend, the different levels of people. So it's people over 75 years of age, and essential workers are in the next big group to get the vaccine. So over 75 is 20 million people and 30 million essential workers. So that's the next 50 million people that are going to get the vaccine.
All right, let's get to some questions here, starting with this. I know someone who had COVID but tested negative for antibodies. Does that mean that he never had COVID, or was it because he was asymptomatic?
It all depends what kind of test they had. Let's assume he had a PCR test and really had COVID, and now has negative antibodies. Antibodies are just one part of the immune system here, but this is actually not a good sign. This person is at high risk for getting a second case of COVID. This person needs the vaccine when they're eligible to take it.
All right, next question. My daughter had a positive COVID test 3 weeks ago. She only has a slight cough now is the last symptom. She is coming to town. Can I catch COVID from her?
Well, she's technically out of quarantine, so that's good. So she's probably not going to give COVID to anybody. But I think, still, you want to use a little common sense.
All right, next question here. We recently heard that New Zealand has lifted all COVID restrictions because they have 0 cases. Is this true? If so, how did they accomplish this without a vaccine?
Well, they did an excellent job in behavioral intervention with the lockdowns in place, with the testing, with the tracing. They did everything right. Plus, it is an island in the southern hemisphere, so it's an isolated place with not a huge, large, congested population. So these things are going in favor of the country, and they had really strong leadership at the top. The president of New Zealand was on top of this from day one.
All right. One other question. Let's say the people if you're 75 years old, you hear you're going to be eligible to get this quickly. Does that mean you stay at home, something comes in the mail? How do you get it?
Well, so it looks like about 7 days after you take the first dose, you begin developing antibodies. So you get some protection, but the maximum antibody protection is 2 weeks after the second dose. So, until you're maximally protected, you should be careful.
No, but how do you know when you can get the first shot?
When the first shot, how are you going to get notified that you're eligible? Okay, I'm sorry, I misunderstood. Yeah, no, what's going to happen is Illinois is divided into the city of Chicago, and everything else is the state of Illinois. So they have their own different plans. It's because the city of Chicago is just so gigantic. And then every state, Indiana and Wisconsin, have their own public health people. So in each one of those places, there's going to be a different sort of set of rules on how you and where you go to get the vaccine. So right now, like in the city, it's the hospitals. The 34 hospitals have the vaccine. But this will ultimately be spreading out to different facilities to give the vaccine. With the Pfizer vaccine, you have to be in or near a hospital setting because of the potential for an allergic reaction, which is not lethal, but you have to be treated. So it will depend on the health authorities.
Gotcha. All right. If you have a question for Dr. Murphy, you can post it on our Morning News Facebook page. We'll talk to him again tomorrow at this time. Thanks, Doctor.
Hey, great. Have a good day.
You too. Hey, Paul. Oh.